Hey guys, I don't know whoever's gonna tune in, not getting the most views right now on every video, but that's okay, because I don't care if just one of you sees it. I appreciate all of you. So, yeah, welcome or welcome back. I don't want to make this video. I really don't. I just feel that it bears worth mentioning. I'm a chronic pain sufferer. And I don't say suffer lightly, because it is suffering. And it does take a toll on your mental health, your relationships, your life, everything. Everything is affected by chronic pain. And for me, just even going to the doctor, I feel like it's just minimized, and I'm made to feel like I'm making it up or it's all in my head. And I was like, yes, pain is processed by the brain, but that doesn't necessarily mean nothing's wrong and you're just, your brain's just fathoming or fabricating this pain. And that's what really upset me. Not this last time, but the time before that I went to my pain specialist. I told her my hands were not okay and they were getting worse, and she just blew me off. She was like, oh, fibromyalgia is a degenerative disease. So I went to my other doctor. I went to my regular doctor, my primary care, and I told her everything that was going on with my hands, because it was newish symptoms and progressively getting worse. And she had me do some tests and checked out my hands and stuff, and she thinks I have carpal tunnel. I'm like, I'm not fishing for more diagnoses. I've already got tons of crap going on. But, like, just going to a pain specialist, and that's the only person you have to rely on. Those are the only people you have to take care of the issue, and they just totally blow you off. Like, that is a very, very common thing. Especially for women, is the stories I've gotten, I do have a friend that did mention, damn, Himari, could you not? What are you playing with? What do you got? Is that the bread tie I was missing? Cats. Anyway. No, I do have a friend who is a male, who is, he was born male. He's a man. And he did mention the fact that, he had a doctor dismiss his symptoms because he's pretty sure he has fibromyalgia, and they're like, oh, that's a woman's disease. So, like, okay, let me get this straight. Women with chronic pain are not believed or are seen as exaggerating, and then men who have chronic pain, either A, they come in with symptoms and are given pain medication and attention right away, or just totally not believed at all. I don't get it. And it's worse. When I worked for a pharmacy, we were trained to treat everybody who had prescriptions for chronic pain, such as narcotics or anything like that, as though they are drug addicts. We were trained that way. We were indoctrinated that way. So I've been on both sides. I've been behind the counter and I've been in front of the counter. Okay? And it's not right. Like, the opioid pandemic that was going on in the United States is not the patient's fault. It's the doctors. It's the pharmaceutical representatives who misrepresented the harm of these drugs. Long-term use is not, it's not recommended. I was on Percocet for, I don't know, like 2 years. When I had my MRI on my back, like even before I had my MRI on my spine, my doctor just wrote me a prescription for 90 Percocet, no questions. This was years ago now, but like 0 questions before I even had my MRI or proof that my spine was injured. And then now it's a pain in the ass to even get like controlled substance medication for my anxiety, which is the only thing that works. Excuse me. Hey, come here. You or being a distraction. Quit. Quit being obnoxious. You're cute, but you're like knocking stuff over and being ornery. Okay? Be good. Thank you. So yeah, it's been, I mean, like the fact that I can't even get a prescription for the only thing that works for acute panic attacks, or the fact that I've gone in the emergency room thinking I was having a heart attack and they told me it was just nerve pain or anxiety or whatever, and they didn't even give me anything for the pain or the anxiety. Like they just told me what it was and sent me on my merry way. That's happened twice. I've gone to the emergency room thinking I was having a fucking heart attack. Like that's how painful I've had flare-ups. And yeah, I've been, I have all the symptoms of fibromyalgia, but at the same time, like my regular doctor, bless her heart, she she believed me about my hands, but she also thinks that fibromyalgia is a trash can diagnosis because it's basically like, oh, well, you just feel pain and we don't know why. That's basically what that diagnosis is. And it causes all manner of issues. And, she just took blood and tested me for every autoimmune disease known to man, and my chronic pain specialist never did. They just would not listen. And this is my actual doctor's assistant, okay? Like, this is the third pain doctor I've had to get because the system is so bad with chronic pain providers. It's just so bad. I mean, I loved my last doctor. He was great. And then my doctor before that was kind of freaking weird. Like, rub your knee, we'll get through this together, making eye contact for too long. Like, just weird. Just a weirdo. He skipped a state. So I'm wondering, maybe somebody, hashtag me too'd his ass and he decided to jump ship before he got, I don't know. He was weird. Anyway, not going to mention names because I'm not going to go there, I'm not even going to go there. But he was weird and he made me uncomfortable. And it was even worse because he's seen my ass. Like, he's given me a spinal epidural. And he's seen my ass. And then I had my next doctor who was at the same clinic, and he was freaking awesome. He gave me medication when I needed it. He wanted to check in on me every other month. Like, he was extremely attentive. He was great. He also left the state. Don't know why. But then I was kind of left high and dry, and I had to go find a provider myself. So, I got a referral from my regular doctor to this place called Colorado Pain Clinic. I shit you not, my mom had a boot on because she had a work-related injury, drove me to this appointment, and we waited almost 2 hours. I had a nurse treat me like shit at that office. I reported them to the board, and I never went back. And so I just went on the website for my insurance and found myself a person, because after that was absolute horseshit. There was a guy actually in the waiting room who was also a patient of my previous doctor that had left the state, and I recognized him because we had been going to that clinic, for a long time, and then we both got referred to the Colorado Pain Clinic, and he almost ran out of fucking oxygen waiting so long for his appointment. I mean, I'm not kidding, his oxygen tank almost ran out. That's how they treat us. They treat us like the scum of the earth. They treat us like degenerates. They treat us like we're making shit up. Treat us like we're drug seeking. I had gone to the ER the day before because as soon as I walked in, the first thing they do is do a UA like you're a freaking criminal. Like, I get it. I mean, but I don't at the same time. Like, they had never seen me before. They're like, oh, UA. And I had paperwork stating I just went to the emergency room the day before because I was walking like Master Yoda and had thrown my back out, no joke, and I got, I was given narcotics in the ER. For once, they gave me pain medicine, for Christ's sake, and so of course they were like, oh, she's drug seeking and all this, and I was up front and gave them the paperwork. These people were assholes. Anyway, that's not an uncommon story. So I guess my point is, like, not only the mental toll and physical toll of trying to find a provider, trying to go tell your story, trying to get care that's proper. It's okay, so a lot of people who suffer with chronic pain end up getting mental diagnoses as a result of, it's just compounded symptoms. I already have bipolar type 1. I've already had anxiety my entire life. Practically, the first time I ever had a panic attack, I was in first grade, and they just treated me like I was being problematic. Told me to grow up, whatever. But yeah, I've had those my entire life, and here we are. I start suffering from chronic pain later in life, like my later teen years and early 20s is when it started to hit, and it's just gotten progressively worse. But I guess the reason I decided to sit down and make this video today is because it takes me sometimes 3 days just to vacuum, if I can even do that. And I'm embarrassed. If people come over randomly, I'm embarrassed. I don't want them to think I'm a waste of fucking space because I can't even clean my space. Laundry is damn near impossible. Vacuuming throws my back out. Swiffering. My hands wiping down tables and stuff. And I like to make art, okay? So it's devastating. Honestly, it's devastating having to mourn the loss of your previous self. And I don't think a lot of people understand. I think a lot of people's family members and spouses and friends and all that just kind of leave people to the wayside because they think this person just wants attention or is being over dramatic, and they're an inconvenience at that point. And that's happened to me multiple times with multiple relationships. They just deteriorated to hell because I couldn't do the things I used to be able to, and I was a disappointment. So it's just disappointing. This whole pandemic shit where everyone's like, oh, I don't want to use Zoom, or I don't want to do this, or it's like Skype, Zoom, Messenger, all those video chatting apps have saved my life more than once. And the people with chronic illness who have not been able to leave their house for a very long time have already known how to use this software. And people bitching about being in isolation, bitching about the stay-at-home order, it's just kind of bullshit to me, because people with chronic illness have been dealing with that for ages. I know I have. Not being able to drive, not being able to go to the grocery store because I'll have a full-blown panic attack and cry in the parking lot. So it's just ridiculous to me how privileged people are without even realizing it, that they can get away with being like, oh, well, I refuse to live this way, and I'm not going to stay home, and I'm not. That's what's pissed me off the most in 2020. I was relieved when we had a stay-at-home order because I had an excuse not to leave the house, because apparently chronic illness isn't a good enough reason. So, this has turned into a rant, and I apologize for that. I'm not trying to be that way, but at the same time, be aware. If you are able to say, if you're in a position and able to say, oh, well, somebody looks fine, they should be okay. Or if you're able to hold down a job, if you're able to clean your house, if you're able to go to the grocery store without feeling like you're having a heart attack or going to die, if you're able to, go to see family members and all that, you should feel privileged for that, honestly. Because not all of us have that privilege, or have had it, even before the COVID crap, And yeah, I'm saying COVID, I don't care. I don't care anymore. I know a bunch of YouTubers are calling it the coof because the videos were getting flagged, but you know what, we're past that point. I don't even give a shit. It is what it is. It's an illness. It's like the flu. Why do we care? But yeah, I don't know. I just wish that things were a little bit different with the treatment of people that suffer like this. And that chronic illness wasn't seen as a disappointment or an inconvenience for the able-bodied people around us, for the people who don't have to deal with it, you know, who don't know or don't have to know what it's like to not even be able to tie your shoes because you can't bend down, or having a dog and you can't lift their food, having people stare at you because you look young and you look okay on the outside and you have to ask a grocery store clerk to lift some shit into your car because you don't want to pop another disc in your back. Like, there's so many things. There's so many examples I have of things I've experienced since this has been a thing. But I just got super emotional earlier because I had to stop vacuuming. I just feel like a failure and I feel like a joke. I don't want anyone else to feel like they're alone in that if that's how they feel. So, I don't know, I think I'll end it with that. This has gone on a little longer than I expected. I just want the people around people with chronic pain to understand that it's not for attention, it's not for special treatment, it's not for any of that. No one would choose that. I mean, people with Munchausen syndrome and shit like that and the WebMD self-diagnosis freaks online, I don't get it. Why would you want to be seen that way? Why would you want to be seen that way? Why would you want pity? That's not even empathy, that's pity. I don't understand. Like, that's not a good feeling for me. I hate being pitied. I hate being looked down upon. It's the worst. Rather friggin', disappear if I could avoid ever being looked at that way again. It's the worst. So, I don't know. Just try out Zoom, try out Skype, try out Messenger, try out FaceTime, please. If somebody tells you they can't make it to an event or something like that, just throw them on a video call. Make them feel included. And make sure, you love yourself and you love each other. And I'll catch you guys in the next one. Bye.